On the occasion of the World Sepsis Day 2020, and on behalf of the Indian Sepsis Forum, I welcome you all to the online symposium on sepsis and COVID, which is presented by Bharat Serum and Vaccines Private Limited. Now we can have the welcome message by Dr. Carlos Sanchez, who's an MD, Education from Venezuela, also from Cuba, currently working as a leader in COVID Task Force and organizing committee member of World Sepsis Meeting from Ecuador.
Hello everyone, I hope you'll be okay. Thank you very much for this kind invitation. My name is Carlos Sanchez.
Now, before we start our discussion for the World Sepsis Day for the online symposium on sepsis and COVID, I'd like to introduce the chairpersons for today's meeting. They don't need any introduction per se. And as Dr. Javeri said, Dr. Rangappa sir is actually, he's busy in a family commitment, so he'll be joining us soon. But just as an introduction, Dr. Pradeep Rangappa, he's a consultant in ICU and currently working with the Columbia Asia Group of Hospitals in Yeshwanthpur. And also we have one of the fathers in the critical care medicine, Dr. Abdullah Sansari, who's a director of the critical care at this Nanavati Super Speciality Hospital in Mumbai. Now moving to the first part of the symposium, that is open discussion on sepsis and COVID, same but different. It is being held by Dr. Yash Javeri sir, who's currently heading as a critical care head and anesthesia and emergency medicine head at Regency Group of Hospitals in Lucknow. He's also known as one of the leaders in critical care in India and renowned worldwide, he actually works towards high quality evidence-based medicine in critical care. He's also the convener of Indian Sepsis Forum and the vice president of the Society of Neurocritical Care. So here to Dr. Yash Javeri sir.
I'm going to discuss sepsis and COVID-19. What are the similarities and what are the differences among these two? It was said by Sir William Osler in 1904 in his essay on evolution of modern medicine. Except on few occasions, the patient appears to die from the body's response to infection rather than from it. This holds very true for sepsis, and it holds equally or probably more true for COVID. The patient is not dying because of the viral replication. The patient is dying because of the physiological perturbations which are induced by the viral replication.
We received a couple of questions during your talk. I would like to take a couple of them in view of the time constraints. Number one being from Mr. Praveen Dandekar, that what can be the role of oral steroids in early disease of COVID-19?
First of all, thank you, Dr. Yash, for organizing such a nice session on the day of the day we celebrate for sepsis, and tell us that we are long way away from achieving our reasonable control on sepsis. And on top of it, COVID-19 has already exposed the weak links in the care, and all of us are challenging at various levels. But one thing is important, it has also brought us together. Nowhere and never in the history of mankind has the whole civilization come together to fight one enemy. And though the number of mortalities have not yet abated well, but I think we all have still put a good unified front.
Yeah, Dr. Harish here. So as you mentioned clearly, so when it comes to COVID-19, like one hand, like the sepsis kind of this one target what initiated, that is the virus. So currently it is being well elaborated by Dr. Yash also. Whatever available antiviral, that is the remdesivir, little bit some favoring evidence is there. Okay, we'll go ahead with that remdesivir. But on the other hand, like what the host is going to respond in a dysregulated, in an uncontrolled way, so that we have some modulation. That is one therapy which showed a good evidence is the steroid.
Thank you so much, Dr. Harish.
Yeah, good afternoon everyone. Dr. Misra here, actually from Hyderabad. Just to add something what Dr. Harish has told. Basically, if you see the recent guideline on steroid, WHO has come out with a guideline for COVID steroid. That is on 2nd of September, if I'm not wrong. What they have told are two things actually. There are two guidelines. Like one is steroids, yes, helpful in COVID, but in severe and critical COVID only.
Just wanted to say we have to consider the three things. One is about the clinical symptoms of the patient. Second, about the history what patient is giving, and you do radiological investigations. I think all this appropriate if you take the proper things of the history, clinical examination, and radiological investigations, because most of the patients are doing CT scan. I think that will give you an appropriate way when to start medications for you.
Thank you so much, Dr. Jaju. So moving on to the next part of the presentation, we have optimizing outcomes in fungal infection. The speaker of this presentation would be Dr. Amit Mandal, and he's one of the most renowned pulmonologists practicing in Mohali, Punjab. He has around 2 decades of experience currently attached to Fortis Group of Hospitals in Mohali. His key areas include pulmonology, critical care, sleep medicine, tuberculosis, and other respiratory problems. Over to the presentation by Dr. Amit Kumar Mandal.
Good afternoon, everybody. Thank you, Yash, for this opportunity. And my apologies, sincere apologies that I have not been able to join in live. And you're going to be hearing this as a recorded version.
Thank you so much. Thank you so much for that presentation, Dr. Mandal. Now we'll move to the last part of the presentation and the symposium before we start taking questions. The last part is actually my journey as a patient by Dr. Gunjan Chanchalani, and she is a chief intensivist at Nanavati Super Speciality Group of Hospitals in Mumbai. I give the presentation to Dr. Gunjan, and here we go.
Thank you, Dr. Charu, and thank you, Dr. Yash, for the opportunity. But I just want to correct here. I am now heading the ICU at Bhatia Hospital. I am no more at Nanavati. Thanks. So thank you, Yash, for this for letting me speak on this, because I did learn a few things as I was a patient while I was admitted as a patient for a COVID. So I learned a few lessons, and retrospectively, I wish I could correct them someday.
Thank you so much, Dr. Gunjan. It was really nice hearing to your entire experience as a patient and your journey. Dr. Yash sir, should we take questions now?
Yeah.
We have a lot of questions in the past 2 hours of our entire symposium. Some of them have been answered, but I'll be going through them. And Dr. Yash, you please let me know which to answer to by whom. So the first question would be, how do we diagnose COVID sepsis?
Serum procalcitonin has nothing to do with COVID sepsis per se. So serum procalcitonin probably would give us an idea if there's a secondary bacterial sepsis, but then COVID sepsis is a different entity altogether.
Dr. Yash sir, would you like to add something to this?
No, I think everything has been answered.
I would like to take one very important question, and I would like Dr. Shashidharan to take this question. What exactly is the role of plasma in arresting the progression of pneumonia in COVID-19? And if there is, then when do you prescribe plasma, and what exactly is the dose of convalescent plasma which you give to the patient?
So I am doing thromboelastography in almost every patient that gets into the ICU. And what I have noticed is 40 to 45% of patients do have a very low RNK values and very high angles and MAs.
Actually, we have data of more than 300 patients where we have used plasma, and most of the time, as Dr. Sanjay told, we have used only 200 ml once, but we have used twice and thrice also in few cases.
Just wanted to, in addition about what discussion going on, the role of thrombolysis, as Dr. Sanjit was mentioning about the thromboelastography, what the people discussing about giving heparin. The thrombolysis, if the showing hypercoagulable state, if you are on the highest dose of the heparin along with the single antiplatelet, we use thrombolysis with alteplase, half dose, not full dose. That also shows a lot of clinical improvement in the oxygenation of the patient.
Thanks, Dr. Yash, for this enlightening session and webinar, and also all the panelists and speaker has shared their views. And I'm sure that with today's discussion, there will be very good treatment for the patient in this testing time. So once again, I thank all the speakers, Dr. Sanjit, Dr. Jaju, Dr. Mishra, Dr. Amit Mandal, despite he was busy in his daily schedule, and there was more need for he to be in ICU. So he shared with us his presentation, which was recorded, but it was very helpful. Also thank Dr. Gunjan, and I also thank all the participants who participated and attended this symposium, and looking forward that there will be more meaningful engagement with all the eminent speakers, and special thanks to Dr. Abdul Ansari as well. He is one of the and all the speakers, they have shared their feedback and their experiences. In future, BSVL, that is Bharat Serums and Vaccines Limited, will like to be associated with the medical fraternity for more such scientific interactions. And once again, I also thank all the attendees who has taken time from their busy schedule, attended this webinar.